Hello, my name is Stacy Kaplan. I work in an infectious disease clinic at Mayo Clinic, Jacksonville, and today I'm going to be talking to you about patient portals. Patient portals are patients' medical records that are digitized. After the Health Information Technology for Economic and Clinical Health Act of 2009, patient portals have been widely adopted. In 2017, over 90% of healthcare organizations offer portal access. Patient portals allow patients to have access to clinical notes, labs, imagings, testing, test results, and message their providers. Patients can also request medical appointments and refill prescriptions. Nurses often serve as the first line of defense for the providers in fielding questions, helping with refilling prescriptions, and acting as a triage for patient messages to get them to the appropriate provider. How does patient portal impact patient-centered care? One impact is that patient portals allow the patient to seek information easily. Having access to their health information and being able to contact their provider often helps the patient self-efficacy. Self-efficacy, or one's ability to take care of one's health, has shown a positive association with patient-centered care. Patients fortified with more information may feel more equipped to engage with their clinical teams. One impact of the patient portal is it allows patients to seek more information. Especially in patients with chronic conditions, a patient's self-efficacy or confidence to exercise control over one's functioning and execute actions to lead to a specific outcome is very important. The portal also allows another avenue for the patients to be able to communicate with their care team through secure messaging. In Chafela et al.'s study, an assessment of patient portal messaging use by patients with multiple chronic conditions living in rural communities found that patients with more complex medical conditions message their doctors more often. They found that the secure messaging can increase patient satisfaction in chronic disease management. Managing complex and challenging health conditions is time-consuming. Zayedi et al. Considers the portal one way to address this challenge in a busy clinical practice. Patient portals have been shown to increase patient engagement, increase patient-centered communication, and improve psychosocial outcome in medical care. What are the benefits and the challenges of the patient portal? The benefits of the patient portal are that patients can have access to their health information from their provider in one place. They can message their provider as well as accomplish other health-related tasks and often get more information on their health. In the paper by Anderson et al., they found that secure messaging had a cost savings of over $4 million in medical care for the patient because treatment was started or directed through secure messaging rather than in a traditional office visit. The drawbacks of a patient portal is first and foremost the digital divide. Lack of access to the internet or lack of comfort using technology limits its usefulness. Zayedi et al.'s study looked at cancer patients' use of patient portal and found that the greatest proportion of non-portal users were females, 75 years or older, non-Hispanic Black participants, and with a household income of under $35,000 a year, and those without a high school education. patient portal technology may exacerbate health equity concerns. Concerns for privacy are also a problem, both with patients not wanting to adopt technology and with the information being available electronically and so able to be intercepted. In the same study mentioned above by Anderson et al., they also found that the money that was saved by the patient comes at a cost to the provider in terms of uncompensated work time. The last few slides cover a study and many graphs of the study of Huang et al. It characterizes patient-clinician communications in secure medical messages. It looked at secure message volumes from 2010 to 2017 at the Mayo Clinic Rochester. They noted as more patients adopted the technology, the volume of messages grew exponentially. As you can see, there are rapid increase in the volume of messages that providers are having to answer. And this comes at a cost to the providers. In summary, the patient portal is a powerful tool that can increase patient-centered care. More needs to be done to bridge the gaps of the digital divide. It is a powerful tool, but as more patients adopt the technology, more support is needed to be provided to the clinicians to be able to keep the lines of communication flowing with their patients and continue to encourage patients to trust us with their information and their lives. Thank you.